At this moment, Mr. Ahmad's condition has deteriorated. He is experiencing septic shock, which is a severe infection caused by pneumonia. This infection has spread into his bloodstream, causing his blood pressure to become unstable and affecting the function of his organ. Because of this, he is now receiving oxygen through a high-flow nasal cannula to help improve his breathing. He is also being treated with intravenous antibiotic to fight the infection and intravenous fluids to support his blood circulation and blood pressure. As he also has diabetes and hypertension, this condition may make his recovery more challenging.
Good morning, sir. I'm gonna check your vital sign. Blood pressure is dropping and oxygen saturation is falling. Mr. Ahmad, are you okay? Patient look less responsive. Charge nurse, can you come here?
What happened?
Staff nurse, can you see this patient vital sign? So I just checked the vital sign and the BP shows 82/50 and the heart rate is also high. His SpO2 also decreasing, although the patient is on HFNC. The respiratory rate is also high and the temperature is also high.
Thank you, Staff Nurse Vanessa. Please repeat the observations and prepare emergency equipment. I will contact the doctor immediately. Good morning, doctor. Can you check Mr. Ahmad's conditions?
Yes, sure. Can you update me?
So Mr. Ahmad's condition has deteriorated over the last 30 minutes. Despite HFNC, oxygen saturation continue to decrease and blood pressure also dropping.
Let me reassess him first. I think he's getting worse lah. I need to increase supportive treatment and I think we should update his family.
Okay, before we meeting the family, let's make sure we provide consistent informations. We will speak in a private room.
Then I will explain the current observation and the nursing care plan.
I will explain regarding the medical condition and answer medical question.
I will provide emotional support and ensure they understand everything. So you guys know your jobs?
Yes.
Good morning. I'm Miss Vanessa. Thank you for coming today. Can you walk me this question?
Good morning, sir. I'm Dr. Ross, and this is Miss Vanessa, and this is Miss Elvira. So we are in charge of your father. So basically, we come here today because we want to discuss your father condition.
Yes, is my father okay? I noticed many nurses going in and out.
Yeah, we understand that you're worried. That's why you want to talk with you privately because there's change in your father's condition.
I'm sorry, unfortunately, despite all the treatment we given to your father, I can see that your father actually is being worsened. The infection is affecting several organs that cause his blood pressure is low. His breathing is become more difficult and he is also less responsive.
As this means he is getting worse.
Yes, actually, because his condition is deteriorating, but we can continue aggressive treatment, but he still remains critically
Will you survive?
I understand why you guys feel, but at this stage, it's really difficult to predict because some patients improve, but some others continue to deteriorate despite the treatment. But right now, our priority is to give the best medical treatment to them.
It's really.
For that, we will keep assessing his comfort and we will give the appropriate interventions for his pain so that he remains.
Will I continue?
Please prepare yourself. You come as soon as you could. What most important now is being here with him.
Can I stay with you?
Yes, for sure. This time we will do our best to accommodate that according to hospital policy, especially because his condition is critical.
Sure, I'll call my siblings.
Yes, it would be appropriate to inform host family so they are aware of the situation.
What treatment is he receiving right now?
So currently he is receiving high flow oxygen. He also receiving intravenous drip antibiotics and drip, and his blood pressure is also supported. And we will also continuously monitoring your father.
Is there anything I can do?
For now, the best thing you can do is stay with him, talk with him gently, and let us know if you have any concern.
Okay. Yes, I'm here.
It's okay, sir. Take your time. You can hold his hand and speak softly.
Keep fighting. You always do. I'm just, I don't know what to do.
You're feeling a completely understandable. You don't have to go through this alone. We are here to support you and your family. If you need more information about your father, you can tell us. So we will give you privacy. If you need any help, you can press call bell over there.
Thank you.
You're welcome. We'll continue monitoring him closely. If there are any changes, we will let you know.
Thank you.
I'm glad we're able to explain the patient condition clearly and at the same time showing empathy.
I know, right? Giving bad news is never easy, but it is very important to be honest, compassionate, and avoid giving false hope to the family member, right?
Yeah, good communications also mean ensuring the family understand, allowing them to ask questions and provide emotional support. Yeah, we'll continue monitoring his conditions, documenting, and keeping the family updated.
Yes, let's continue working together to provide best treatment for the patient, okay?
Okay, so I'll continue monitoring his vital sign every 15 minutes and document all observations.
Alright, if his condition become worse, we will release the new treatment plan and then keep the family updated.
Good teamwork, everyone. So, clear communication and family support are essential to these situations like this now.